Welcome back to the American College of Surgeons Bulletin Brief from the Front Lines, Surgeons' Voices. And with me today is our leader, our newly elected president, Dr. Wayne Meredith. Dr. Meredith is, of course, the Richard T. Myers Professor and Chair of Surgery at Wake Forest Medical School. And I'm absolutely delighted to be able to speak with Dr. Meredith today.
It's great to see you, Steve. I think these are really terrific and they provide a great service for our fellows. And I love listening to them.
Well, thank you very much for allowing me the privilege of doing them. I get an education chatting with people before and after we record and learning, reading up before I talk to people. So I appreciate it. I was able to do it under the leadership of Dr. Roosh, and thanks for allowing me to continue to do it under your leadership. We're looking forward to a spectacular year with you at the helm of our college. Your presidential address was sensational. You managed to get in less than 20 minutes an incredible number of important points from racism to your upbringing and the touching remarks about and photos with your parents, and towards the end, some very poignant advice for all surgeons. So we could have a very, very long interview just about that address, but I'm instead going to tell everyone who's seen it, watch it again and again. And anyone who hasn't seen it, you're obliged to see it because it's fantastic.
Thank you very much.
So let's instead talk about your plans for the year. You're president of the American College of Surgeons in some rather interesting times, to say the least.
Well, we are working in really unique times. That I guess the forces that are facing us are COVID and how we rearrange ourselves in response to that. And I do have a lot of things I want to make sure we tend to in the year. I've spent a lot of time as president-elect chairing the Regents Task Force on Racism. And that group has brought a very thoughtful group, brought together a lot of ideas and action items that we've recommended to the Board of Regents, and the Board of Regents has accepted that report. And I want to spend some time, energy, discretionary time to make sure that that body of work gets off the ground, gets running, and gets made permanent. And I think I think it will be terrific for us as a college. A lot of internal things that we can do to have a better culture, some things we can do to have a better diverse and culturally competent workforce, some things we can do in the research arena, and some things we can do in the advocacy arena, in all of those areas. And so I think it's going to be very exciting. For those of you who are out there, we formed a Regents Committee on Racism that will hold us as a governing board accountable for making progress in these areas. We've formed a diversity office of the college to support that group. The governors have formed a pillar. One of the governor's pillars is now diversity. And I think we will be coordinating through that. There's already been a diversity committee of the college, which I think needs to grow and become more available. And I think we need to be learning tools and techniques about how to deal with anti-racism and diversity that we spread to chapters. And I think people are interested in this topic in the profession of surgery. We'll have lots of opportunity to interface with the college, and the college has lots of obligation and opportunity to be a resource for people in the profession of surgery to help change the culture of our profession. I think it can be really profound, and I look forward to the year working on that.
Well, fantastic. And I know we are going to accomplish those goals for sure, because all of the regents are stoutly and unanimously behind those efforts and seeing those efforts achieved. I think we've proven in the last year more than ever that the college, when it's committed to do something, it does it exceptionally well. There is no doubt whatsoever. So one of the things that I think we did exceptionally well, one of many, was the annual clinical congress, at which time you were inducted as our president. So question many people have asked us regents in the last couple of days is, well, what happens next year? What if we do get back together in person, and hopefully we will there still be the opportunity to participate from remote locations where finances may prohibit people traveling to the U.S.?
Well, so I'm a trauma surgeon. And I can't count the number of times I have gotten involved in figuring out how to manage some complex injury that I haven't seen or haven't seen quite like that, and had to scramble and figure out a new thing. And then all of a sudden, you learn from that. You learn a new way. You learn something to add to your repertoire. That's what we need to do with what COVID has done to us for the Clinical Congress. I think it was unbelievably successful. There were over 30,000 people signed up to do it. People from all over the world. I think it was 120 some countries out of 140. I may have those numbers not quite precise, but that's kind of magnitude of impact internationally. And so just like when you find yourself, you have to do a tough case and you have to figure out some new way to do it. You need to learn from that, and we need to do that with this. Right? So I think we need to figure out a way to make some hybrid model that takes the things we've learned about how to deliver distance learning, distance participation in the college, and have that. I don't think we should go back to doing the hard case every time. I think we need to do the normal cases and offer it as much as we can, because there's a lot of convening, there's a lot of networking, there's a lot of business, there's a lot of education, there's a lot of getting to meet the professor that's giving the lecture or talk about the panel and ask about questions that goes on at the clinical congress. So we need to have that convening feature as well, but we need to add to our repertoire the skills that we've learned this year. And I think one of the jobs we have to do this year is figure out how to make a hybrid of that takes the best of both worlds and makes it so that it's available all over the world. It's available to people that don't have 3 days to take out of their practice, but they do have a day to take out of their practice and maybe several nights later. But it's also a place where we can convene and do some of the business that we do there. Plus, you get to meet people and see people. I miss that. I really miss that a lot.
Yeah, 100%. I miss seeing people, socializing with people. I mean, we as humans are social beings and we live in a social structure, and
Human
now,
contact.
yeah, we're
Human
deprived of that
contact.
structure. And a lot of things get done in hallways between sessions and at lunches and dinners during the
Right.
meeting, but
Right. That's exactly right.
we don't have that opportunity. One of the other facets of our lives that has gone to a video platform to some degree is patient interaction as well. So we have the interaction with each other in educational venues as well as business forums like committee meetings and board meetings. But there's also patient visits, and if you have a patient who is visiting in town and trauma, and you operate, and now they're some remote place, and instead of making them come in, maybe you're going to see them by video. What's the college's role going to be in trying to take it? It's just like the virtual conferences in some way. We kind of stumbled upon it. We're not going to abandon seeing patients in person, but we're probably not going to abandon telemedicine either. So how is the college going to help us out?
I think there's a lot to be learned from the imposition of COVID that it imposed on our practices to have more video visits. I think the technology is coming along fast to make that better. And so just like during COVID, the college pulled together the ways to tier down cases and tier up cases and how to have small business loans and how to do all that. Is it just as an outgrowth of follow through on that, just like trauma's pre-hospital acute phase, and the last part is rehab, right? The last part of COVID for us may be teaching surgeons how to integrate video visits into their practice, lobbying at the federal government level to make and payer level to get it paid properly, and showing people how to do some of those things. And I think there are enough experiments going on out there in practices all over the country that if we can be a convener to some of that knowledge to help surgeons learn what's the best technology, what's the best patient mix, what's the best type of patients to see, what can you see, who can you see post-op in a perfectly video world, who can you see pre-op perfectly video and sort, how much of your ancillary staff work. Think about how much in bariatric surgery can be done virtual as opposed to the in-person visits with all the training and weight loss management that precedes, and a lot of prehab work we can do. I think there's an awful lot that we need to all as a community of surgeons be figuring out. The American College needs to be convening that and collating that and giving people advice, and then advocating for surgeons at the payer level and the federal level get that work recognized properly and figure out how to do it. I think there's a lot of work we need to do in the virtual space as we go forward.
And touching upon the theme of work and work to be done, at the end of your remarks, you spoke about serving with skill and fidelity, and the college is here to serve you. So, how do you recommend that particularly younger surgeons, resident associate society, young fellows get engaged with the college to be able to afford themselves the opportunity and the privilege to work together to help us help our patients?
I remember back when I first became a fellow and started getting engaged in the college, it's such a big organization. There's so many facets to it. It's hard to figure out how it works. It's hard to get engaged, but I will say that it is, though it appears intimidating, it is actually a very inviting organization. We are looking for people who are interested in working on the things that we do. And that is basically serving surgeons who practice surgery, education, advocacy, quality efforts, in every way you can imagine. We are interested in doing that. So if you're interested in volunteering time, making a contribution, there's a way for you to get involved in the college. And some of the easier ways is to get involved in your state chapter. I highly recommend that. I stay engaged. I'm still on the board of my state chapter. I have been for 20 some years. It's an avenue to get to the rest of the college, but it's also a unique group of people, so that I know surgeons from all around the area. I know referral groups. I know I can help place residents in practices, and I can learn what's going on out there in the practice world. And I just get to meet people that I wouldn't otherwise meet. So I would say everybody needs to be joining the chapter and getting involved in the chapter. They're going to the clinical congress and going to some of the other college-sponsored meetings is a great way to get involved. And you will meet people there that will have ideas about what you're doing. You can just go introduce yourself to them and say, I'm interested in working on this, and that'll stick some of the time. And some of the time they'll pass you off because they don't have a need, but keep pitching that. There will be that. And the other fantastic place to go, and one of the easiest ways to get through this is your state chapter, is the Leadership Summit. People who want to volunteer at the Leadership Summit, there's an awful lot of work that can be done there. We have advisory councils to which you can be appointed, and for every specialty within the House of Surgery. Let me be sure to come back and talk about the House of Surgery. But within the House of Surgery across otolaryngology and urology, but also within the specialties in general surgery, of bariatrics, every one of them. So there's advisory councils that advise the college on what those things are. There's lots of work to be done there to have education. And you can serve on committees of the college without being a governor or regent or any of those groups. Those positions, governors and regents in those positions, are appointed by assigned bodies, for those of you who don't know. So the Southern Surgical Association, the Society of Surgery for the Alimentary Tract has a governor's post that they nominate maybe 3 people, and the governor's nominating committee picks amongst those, and that's how you become a governor. And those people who become governors do so by serving that part of their field and being engaged in the American College of Surgeons. And so these other techniques are prerequisite, really, to becoming part of the leadership of the college. But it's a wide open field. We need people, and we need good people.
And you touched upon the House of Surgery and said you'd come back to it.
Well, I think this year, one of the things I'd like to see us do, we have begun before, but I'd like to see more progress made and continue to work on this, is reaching out to surgical specialties, orthopedics, urology, cardiac surgery, ENT, reaching out to those specialty surgeons and those specialty societies and finding the areas where we can make the House of Surgery strong. We've developed a surgical coalition with many of the surgical specialties, and we have had a much stronger voice in Washington, especially over surprise billing and really especially over the impending CMS cuts. We are way stronger together in a lot of areas, and I think we need to be doing that, not just in advocacy, but we need to be exploring. We need to get to know each other. We need to be able to leverage our strengths and build a house of surgery in lots of ways. There's no way that we're gonna have enough educational content that a whole lot of orthopedic surgeons are going to come to the clinical congress to learn how to do a hip replacement. But there are a lot of things that we do in common that especially as we get more hybrid and have more video content where we can work together better to move the profession of surgery and the way surgeons are treated in this country positively, and share educational opportunities about video visits would be a great example, right? Or billing and compliance. So there are a lot of things that we have in common. We're much better, stronger together. And I think we ought to be working on that this year. That would be another area where we ought to work.
Well, thank you. A lot of outstanding plans that you've outlined for us for the coming year, and I know we're going to achieve them. Any parting words for us?
Welcome. I hope everybody here did join the Clinical Congress. We'll have something great for you next year. And as I said in my closing of this, consider this a formal invitation to get involved in the American College of Surgeons, right? If you are committed to serving all with skill and fidelity, we are here to serve you.
Thank you very much. An excellent conclusion to your presidential address and an excellent conclusion today to our interview. I wish you sustained health, success in your new role as our president, and hope we do get to meet at some point in person during
That's exactly right. We need more of that. Thanks for doing these, Steve. This is really terrific.
My pleasure.
Appreciate it.